Disorders of Consciousness program is a special type of brain injury program that addresses those patients that are involved that had severe brain injuries and they started being in a coma, and then slowly they're progressing from that coma, but they're not quite fully conscious yet.
Being the only DOC program in Central Florida, the main purpose initially is to provide the accurate diagnosis for what we call emergence from a disordered of consciousness state. There's two things necessary to emerge and be a minimally conscious state, and that is, can he communicate with me and can he use an object functionally? Knowing those little things and knowing the intricacies of the brain that go into those what seem like simple tasks is what makes the DOC program so special.
They come to us and we try everything in our power to stimulate and help that emergence from disordered consciousness state.
It takes a village of specialists to be able to work within a disorders of consciousness program. From the physicians, our nursing team, our physical, occupational, and speech therapists, and our recreational team trying to revive a little bit of normalness in a situation that is completely abnormal.
When it comes to DOC patients, the patients need interdisciplinary care, meaning oftentimes they need a co-treatment based on the severity of their injury in order to have the optimal type of treatment that they need. So when it comes to communication, there'll be times when myself and the physical therapist might collaborate together. They're having the patient stand. I have them the most best position for respiratory support to help them engage in communication.
Look at the apple.
Cristian is an amazing young man who was unfortunately in a car accident, which left him in a coma. So our main goal at first was what we could do to help wake his brain up.
Kick left.
Initially, it was a lot of activities to help him with like visual tracking to the right, improving alertness, providing sensory stimulation to help him in the emergence process.
Give him one more little kiss.
Dogs have been very involved in what I've done with him, so we started with having a dog bark at him or lick him just to get him to respond. And as we progressed over time, he was able to brush, feed, pet. A lot of those things started becoming automatic.
One thing that is severely undervalued is a patient's support system at the beginning stages of recovery from a severe brain injury like this one.
Oh, it's like 7.
Cristian's mom has been here from day one, and all the other people in his life, but his mom was able to be there in the sessions, watching, asking questions appropriately, and then carrying them over and asking, what could I do outside of therapy? That's when we start to see those things start to connect. So the more we got engagement in outside of therapy, that was huge for Cristian.
Cristian is amazing to me because of the progress that he has made in such a short amount of time. He came here to us in September, and it is now November, and Cristian is getting to go home. That's amazing.
But these pathways in his head will continue to be reinforced and continue to get better for up to 2 years after the original injury. Orlando Health is a leader in the sense that they're able to take this patient that we're going to say, he's okay to go home from the hospital now. He can get back to some of the things that he was doing before. We're going to continue supporting him. We have all the resources that we need to make sure 2 years from now we look back and we say we did everything we can to push him forward to have the best recovery.
Job well done. We did it. Yeah. Makes me feel good.
I'm so proud. I get goosebumps when I think about it, to be honest, because it's just such an amazing recovery story.
And to see that I was able to have a small part in his outcome is, I can't even put it into words.
It's very rewarding. It's the most rewarding that you can have in your career.
When I'm able to go into Cristian's room now, and he and I are able to have a discussion about his discharge date. That conversation beyond expectations, beyond dreams.
And I know as he walks throughout these doors that there's more to come. So I'm excited to see him leave and to continue on with that journey.
Gosh, from the bottom of my heart, just thank you so much for believing in him and for giving us the best shot. So I wanted to make sure we could say we did everything we could for Cristian, and gosh, they did. He's gonna walk out of here and say bye.